Mr. Obviously, we in P4Profit welcome this bill. It's quite progressive, and also the issue around the contraception scheme. I think it's quite progressive as well. Outpatient charges are not conducive to Sláinte care whatsoever, and I think you will probably agree with that. And most people that will be listening will be asking themselves, why do we actually pay inpatient charges in the first place? So this is welcome, but there's obviously a long way still to go, because children who attend emergency department will still be charged, if they don't have a medical card, €100 for every visit that they do. So it's still not progressive in relation to what we're talking about, and also the existing charges still exist in relation to inpatient, and that inpatient charges, which can be very kind of financially a burden on those that have to visit hospitals on numerous occasions. So that is, I don't think that's kind of conducive again to the policy of Sláinte care. And all this, Minister, the kind of the juxtaposition in relation to outpatient charges and inpatient charges is in relation to debt collection. And an incredible stat, I'll read it out to you, is that the HSE in the last 3 years paid €1.3 million to debt collectors. So the HSE pay all that money over the last number of years to debt collectors to chase people up because they haven't paid their charges. Now, to me, that is a complete waste of money. All that money, that 1.3 million, could be easily spent in kind of healthcare in relation to, you know, when people present themselves in EDs. What's that?
Do we know how much the 1.3 million?
A fraction of that. A fraction. No, the 1.3 million was spent by the HSE to debt collectors.
How much did the debt collectors collect?
Well, I'm trying to get that information now.
All right.
Yeah, so it's that would be very, very interesting. See how much money they actually gather. But the big question is, charges should be abolished, full stop, because the amount of bureaucracy that goes into this, in relation to paying debt collectors, and also the administration work in relation to inpatient fees, is I don't think it's, as I said, I don't think it's conducive. So, Minister, this is kind of, I suppose, in the clouds of kind of the cost of living crisis that many families are going through. So it's welcome that this is happening in relation to healthcare, as people that have to kind of access healthcare and so forth. So look, I think it's welcome that this is happening, but I think there's a long way to go in relation to stealth costs in our health system. And I know Sláinte care is trying to have a universal healthcare system access at when people need access, that they don't have a financial kind of penalty to pay. So that's a very, very good thing, Minister. But there's still a long way to go to complete the policy of Sláinte care. Thank you.